Could that weird cramp or sudden nausea mean you're pregnant? Or is it something to worry about? In this video, I'll break down the most common early pregnancy symptoms, what's totally normal, and when you should call your doctor. Let's get into it. Hey mamas! Welcome to Empowered Pregnancy, your go-to space for everything pregnancy related. If you're new here, make sure to hit that subscribe button and turn on notifications so you don't miss out on expert tips, real advice, and all things baby related. Now let's talk about early pregnancy symptoms, what's expected and what's a red flag. Okay, let's start with the most obvious sign, a missed period. If your period is usually like clockwork and suddenly it's MIA and you've been sexually active, it's time to grab a pregnancy test. Home pregnancy tests are super accurate these days, especially if you use them correctly. Even if the test is negative but you still haven't gotten your period, it's worth taking another test in a few days or reaching out to your doctor just to be sure. Let's talk about morning sickness, the dreaded nausea and sometimes even vomiting that can hit you like a ton of bricks. And not just in the morning, right? It's usually thanks to those hormonal shifts going on in your body. While it's called morning sickness, it can actually strike at any time of day or night. The good news is that it usually starts to subside as you enter the second trimester. In the meantime, try eating small, frequent meals throughout the day and keep those snacks handy. Crackers, ginger ale, anything bland that can help settle your stomach. Next up, let's talk about those girls, your breasts. One of the earliest signs of pregnancy can be tender, swollen, or even slightly larger breasts. This is all thanks to, you guessed it, hormones. Estrogen and progesterone are working overtime preparing your body for breastfeeding. A comfortable, supportive bra can be your new best friend during this time. Chapter 4. Fatigue, or as we like to call it, hello exhaustion. Feeling like you could sleep for a week straight? Yeah, that's totally normal in early pregnancy. Growing a tiny human is a lot of work. Your body is working overtime to support your growing baby. So, give yourself permission to rest and recharge. Take naps when you can, go to bed early, and don't feel guilty about saying no to social engagements if you're feeling wiped out. Chapter 5. Frequent urination or always peeing, constantly running to the bathroom? You're not alone. Frequent urination is a super common early pregnancy symptom. As your uterus grows, it puts pressure on your bladder, making you feel like you have to pee all the time. Plus, your kidneys are working hard to filter all that extra blood volume. Just make sure you're staying hydrated, even if it means more trips to the bathroom. Chapter 6. Severe abdominal pain or cramps, or when to worry. Now let's talk about abdominal pain and cramps. It's normal to feel some mild cramping in early pregnancy as your uterus expands. However, if you experience severe pain, especially on one side, or sharp, stabbing cramps, it's crucial to contact your doctor immediately. This could be a sign of an ectopic pregnancy, a serious condition where the fertilized egg implants outside the uterus. Other red flags include heavy bleeding, dizziness, or fainting. It's not uncommon to experience some light spotting or very light bleeding in early pregnancy. This is often called implantation bleeding and can happen when the fertilized egg attaches to the uterine lining. However, if you're experiencing heavy bleeding, like soaking through a pad or more, it's essential to contact your doctor right away. This could be a sign of a miscarriage or other complications. Feeling a little dizzy or lightheaded now and then is pretty common in early pregnancy, especially during the first trimester. Those hormonal changes can cause your blood vessels to relax and widen, which can lead to lower blood pressure. To help prevent dizziness, make sure you're staying hydrated, eating regular meals, and avoiding standing for long periods. If you experience frequent dizziness or fainting, it's important to let your doctor know. We talked about morning sickness earlier, but for some women, it can be much more severe and debilitating. This is called hyperemesis gravidarum, and it's not your typical morning sickness. If you're vomiting frequently, unable to keep any food or liquids down, feeling constantly nauseous, and even losing weight, it's crucial to seek medical attention. Your doctor can help manage the symptoms with medication, IV fluids, and dietary changes to ensure you're getting the nutrients you and your baby need. Headaches are common during pregnancy, but if you experience severe, persistent headaches, especially after 20 weeks, it's important to contact your doctor. Additionally, if you notice any vision changes, such as blurry vision, seeing spots, or flashing lights, seek medical attention immediately. These could be signs of preeclampsia, a serious condition characterized by high blood pressure and protein in the urine. Don't hesitate to reach out to your doctor if you have any concerns about headaches or vision changes. All right, mamas. I hope this video helped you understand what's normal and when to worry during early pregnancy. Have you experienced any of these symptoms? Drop a comment below and share your story. I'd love to hear from you. And if you have any questions, don't hesitate to ask. Don't forget to like this video, subscribe for more pregnancy tips, and turn on notifications so you never miss an update. Thanks for watching, and I'll see you in the next one.